we wanted to take this also to the frontline workers. This was National Nurses or Teachers Week, as well as Nurses Day and Nurses Week. Next week, we will have a special issue of the Washington Informer, which gives tributes to nurses, because, if anybody's been in the hospital, we just know how important nurses have been in the health and welfare of patients. And the doctors come in and they do their thing, but the nurses pretty much stay there. And they are the ones, the new heroes in our community. When we see them now, especially if they're dressed in their uniforms, or even if we just happen to know their nurse, we will be saying from henceforth and forever, thank you for your service, because they have really been on the front lines. So I'd like to bring to the show right now, Dr. Secil Shodroski. How are you? Dr. Schodroski, can you hear me? Can you hear me? Hello? No, Dr. Schodroski, we're having some technical difficulties here. I hope she's not on mute. She may have muted her computer. Are you there? She's in St. Louis. I've had a lot of conversations with folks from St. Louis today. And Dr. Schodroski is a doctor of nursing practice and owner of the Health Wellness Center in St. Louis, Missouri. And she's also an author. So I'm hoping that we can get her up on the line. It's not working. So in the meantime, we're going to welcome Shanika Clegg, bring us back to DC, closer to home. And Shanika is a nurse with the DC Fire and EMS. But not only that, she's a mom. And we're tying this show into Mother's Day as well. And it's got to be tough. I mean, fortunately, you said you're not in. Well, first of all, welcome to the show.
Thank you. Thank you. Happy to be here.
Thank you. Thank you. Doc, are you there?
Yes, I'm here. Good
midday. Good. Yeah. Wonderful. Wonderful. So we have both of you here. That's great. And both of you all are what I call frontline workers, whether you're actually in the hospitals, but you've got your families, you're dealing with people with this COVID. Tell me just personally what this experience has been like for you. And I'll start with you. Make sure I have that pronounced right. Shodroski?
That is correct.
Okay, Dr. Shodroski, tell me how you've been addressing this from your perspective.
You can just call me Dr. Secil. That's the brand we use, Dr. Secil, which is my first name. But I've been here in New York for last night.
We just lost her again. All right, so Shanika.
Yeah, I'm here.
Okay. Can you respond to that? How have you been managing with this COVID-19? Not only, let's start professionally with your relationship with Fire and EMS, and then as a mom.
Well, it has been challenging at some times. We have a team of 8, little more, but a team of 8 who, deals with the fire department with the whole COVID thing. Very stressful because there's so many unknowns out here. When I come home, I have to, I dress in normal clothes, but when I come home, this all comes off in my washer, checking my kids all the time. Even though I'm in the office, I'm around other individuals. We all wear masks while we're in the office, and basically checking on our members, making sure they're fine. The ones that we have off from work on isolation, we are checking on them daily, some every other day, to make sure they're fine.
Mm-hmm. I know that we've had several incidences of EMS and Metropolitan Police officers. Both have that have been affected by the by COVID-19. What's it been like in the department?
Um, the department is real strenuous. I mean, we have about 100 firefighters who tested positive for COVID. They're doing well. Thank God for that. We had maybe a few that was hospitalized, but they came back on top. We haven't had any deaths. Thank you in the fire department. The um, we have a lot of members that are who were exposed by some firefighters or COVID positive patients that are now on isolation, and they're doing. A lot of them are doing well. They're living out their 14-day quarantine, and then we'll have them back to work soon to help the community
So
again.
exactly. And then, of course, not only is it COVID-19, but it's all the other things that are going on right now. With I just heard the mayor's press conference before coming here, and one of the questions one of our reporters, James Wright, asked was if it's true that people who may suffer from other conditions don't believe as though they should go to the hospital because they won't be treated. And the mayor said, of course, that's not true, but do you all find that that's a question that people ask when they call in? I know you're not on the call center, but when people are having health issues and they think they need to go to the hospital, are they asking, well, can I go? Will they treat me? You know, what's going to happen? Do you have any idea about how that's playing out?
No, I don't know exactly how the calls are coming in and what questions are being asked doing that because I'm not in the call center.
Okay.
A lot of people that I've noticed from different runs that when our EMS providers do get on a call and ask them what's going on, sometimes we're treating them, and then they're like, I don't want to go to hospital, because a lot of them are scared to go to hospital.
Right.
Hospitals to
That
them
was
are
the other part.
Yeah, the hospitals to them are the COVID center, so a lot of them don't want to go. But as far as the 911 call center, I couldn't answer that.
Okay. Well, Dr. Secil, we've got you back.
Hi.
Yes, yeah. And I understand you just got off duty. So you're in New York.
Yeah, I've been up for a very long time. I think we left the hospital probably around 8, and I arrived there at about 6:45 yesterday evening. So I've been up for a very long time. Um, you asked me a question before the phone went out, but I just want to tell you, last night was my 21st 12-hour shift in a row, night shift. And being here in New York has been very humbling for me. The atmosphere is different. It's very quiet out there. We're all wearing masks. My colleagues, we're knowing each other with masks on, but I'm afraid that if I seen them 2 months from now, I wouldn't even know who they are because we've been covered up. It's hard for me to breathe at night. My lips, I've just put a lot of ointment on them today, here at the hotel because my lips are hurting. They're burning, they're chapped, they're from wearing that protective equipment for over 12 hours at a time. My hands are raw. They're peeling. I've got open areas on my hands from the constant washing, the constant sanitizer, the exchanging of the gloves constantly. Um, it's been a couple of times I felt like I was going to pass out because we've got so much equipment on, especially when I have my shield on top of my mask. I believe I'm breathing in more carbon dioxide, so it makes you dizzy. It's not true oxygen. These are things that us folks that are on the front lines as medical providers are having to deal with and putting our lives on the line. But at the same time, is in our blood, is our assignment here on earth is to take care of everybody. And we just do what comes instinct for us to do, even though we're hurting our, we're having some pain or having some issues ourselves, and we just there's no reason for me to complain about it or be upset about it. Um, I I just wanted to explain and express so people can understand that it is true that we probably need to stay home. We need to open the country up slowly and be very vigilant and mindful. Just because the economy system is down or decreased, we shouldn't just automatically look at wealth over health. And I get it, I understand. But what good is the money and things like that if you're not alive to enjoy it or be with your family? It should be health over wealth. And I get we all have obligations and responsibilities. But if we don't settle down, the virus. Are you there?
So what are you? Yeah, yeah. I think and I will probably ask you to repeat that part too. But what are you? What is your line of duty? What are you doing? What did you volunteer to do in New York?
I am a family nurse practitioner with a PhD. So in St. Louis, I own a couple of clinics, and I'm Dr. Cecil. I have taken a role of a RN here uh, at the hospital. I had
And which
not.
hospital is that?
I, I don't know if I'm supposed to say that or not.
Okay, all right. Go
Okay,
ahead.
but the hospital is in the Bronx. Okay, and I'm staying in Manhattan. Or in Times Square. So I can tell you maybe that much. This facility is not is up to date, is outdated, is not as clean as I prefer. It's I don't like to use the bathroom there. I am making the best of the situation of what it is and just taking care of people as I have been asked to do and as I had. So is my assignment here on earth. So I just do what I was expected of me. In the mornings, I see medical providers come to my room. I have vitamin infusions here. I infuse vitamin infusions to the medical providers that are here to help keep our immunity up. I have injections here. I have everything here from my clinic. My room is basically a clinic on one side. Um, I have a lot of packages and things here. I am giving to all of the medical providers, all of the patients, so that everybody have all their essentials being met without having to go to the store or having to worry if you have toiletries or if you have food. Hospital staff have been low on food with their kids at home. I have everything in here. I've been giving the hospital staff and their families groceries, bread, lotion, toothpaste, toothbrush, whatever. I have everything here. Um, so
Wow, that's
I,
wonderful.
yes, ma'am. I believe that I'm my ancestors' dream. I believe that I'm little Harriet Tubman Jr. I believe that I'm the African American Florence Nightingale. I don't care. I just stay up. I just stay awake. I'll sleep for a few hours, but my assignment here is to take care of the Lord's people. He's asking for our attention, and I think some people is not. They're not giving the Lord what He's asking for. They need to be obedient, and that's where
Well,
my
it's
belief.
interesting because my question was going to be to you, but I think you've answered it well already. And that was, had you known what you were getting into before you left St. Louis, would you still come? If you'd known
That's
ahead of time.
that's not even a question. Somebody asked me to do something, and I have the capabilities to do it. I have all the PPE. I have all this stuff in my office. I had everything. So there
Yeah,
was no sense in of me not offering what I have.
right. And
Yes,
why New York as opposed to St. Louis? Because it was ground zero, or because this is all over?
I was
Why did you
asked.
decide to?
I was
Okay,
asked to come.
okay,
Yeah, several of
all
my
right,
friends were here. They were asking me, Cecil, we need this, we need that. And I was calling my vendors. I was getting more supplies. I spent over $3,000 getting supplies out of my own money just to bring here to make sure people had what they needed. Uh,
right, right.
I just, that is in my blood. I can't help it. My kids were at the airport with me, my two daughters. I do everything in front of them. I want them to see the strongest woman I've could ever be, so they can know that it's possible. They're 16 and 17. I'm setting a huge example. The youngest one didn't want me
Yeah.
to leave. She was afraid, but she tells me how proud she is of me. When you hear your
Yeah.
child say that, that's big. It's huge for me.
Right. Right.
Yeah, yeah.
Well, I know that you haven't had any rest. You got home not too long ago. I want you to go ahead and take some time.
Yes, ma'am.
I just wanted to have this opportunity to talk to you again as I'm going to talk to Shanika about a little bit more. But
Yes,
thank
ma'am.
you for your service,
Yes, ma'am.
and you know, just stay safe.
Yes, ma'am. You can call me anytime. I have a lot of things we can discuss.
Okay. All right.
Yes,
Wonderful. And
ma'am.
happy Mother's Day.
Happy Mother's Day, ladies. Thank you for reaching
Yes,
out.
happy Mother's
Thank
Day.
you. Thank you for making me a part of the show today. And
We appreciate you.
I'm grateful. Thank you so much.